Welcome to RPTV Weekly News. I'm Kedar, joined by Gabriel and Jabin, ready to bring you the latest updates from Regent Park and its surroundings.
In this episode, we'll cover important events and community updates from August 30th to September 5th. Stay with us for the news that matters to our community.
MPP Kristyn Wong-Tam speaks out on safe injection site closures. Downtown East comes together on International Overdose Awareness Day. Low-income communities fight back against developers in Toronto. Regent Park Neighbourhood Association encourages community involvement. Regent Park Fashion Show highlights local talent and sustainability. Sunday in the Park Appreciation Dinner celebrates community spirit. Events and jobs in Regent Park community.
Regent Park Neighbourhood Association encourages community involvement. On Wednesday, September the 4th, 2024, the Regent Park Neighbourhood Association, RPNA, hosted a community session to engage residents interested in becoming members. The meeting was led by Pavitra Salanthar, Ismail Afra, and Walid Kogali, who provided an overview of the RPNA's mission, governance, and ongoing advocacy work. The presentation highlighted the association's key accomplishments, current projects, and the board election process. Residents were also given information on corporate membership and had the opportunity to participate in a Q&A session.
The Neighborhood Association began in 2017 as Regent Park was starting its initial phase of development. In 2017, we ran an election process and we recruited members. And from then on, the organization began. Some of our earlier work involved advocating for the community because it was a time of change for the neighborhood. One of the first initiatives we worked on was making sure that as this community is being revitalized, that there are investments that are coming into the neighborhood. So one example was when this neighborhood was being built, Toronto Community Housing had a physical plan, and so they also had what's called a social development plan. So we made sure and advocated to make sure that that plan was invested. So we approached at the time City Councillor Wong-Tam. We began conversation. We asked, what is the future for this neighborhood? This neighborhood is going through a massive transformation. We have 100% Toronto housing. We are getting new residents in the community. What's the level of investments that should help in that process? So that conversation led to an investment of $2.5 million for social development. So this year, every year, $500,000 is allocated to spend on the neighborhood. So grassroots groups like youth programs, employment programs, safety programs are run on these investments. So today, the City of Toronto is releasing those funds so that any grassroots group in Regent Park can participate. So we've secured that. We've also secured in our conversation $26.75 million in community benefits. This began, it was a long effort and journey to get the developers and Toronto Community Housing to partner with us so that this community could be well resourced. So after tense conversation and discussion, we secured $26.75 million for community benefits. So this will be spent on scholarships, employment, and other initiatives. So today, lots of our youth, people who are going to university for the first time, were attending university for free because of that scholarship program. So in the future years also, they're able to attend schooling for free because of the grants that come from this money. So if you know, if you have high school students who are going to university, and want free tuition, they can apply to this program and get their education paid for. Also, this year they will be consulting residents. So they will be asking residents, we have 26 million, how would you like to spend that money? Do you want to spend it on employment? Do you want to spend it on safety? So they will consult the community, and the community will decide based on community priorities where that money will be allocated. This was done because of the Neighborhood Association, and we worked hard to make that a community-led process. So we were very busy with advocacy initiatives in our early years. So later on, the organization developed, COVID-19 hit, the pandemic hit, it took a toll on many organizations, and just like other organizations, our organization was also hit. But because of the toll, we noticed that there was a gap in technology. So that's why we came up with interesting pilots. We came up with the cafe program. We came up with the technology so that people could have access to online internet and devices. So much of that was, we piloted these programs, and it proved to be very successful, and residents were very interested. So we hope to continue programs like this in the future as well. So what's the reason we're here tonight? Tonight we're here because after the pandemic, we are again coming back to community and recruiting corporate members. We are gearing up for our elections. Because we are resident-led, we are informed by residents, and we need resident participation in all of our activities. So we will be running an election in September 25, where you will decide who will represent you, and you will elect people to sit on the board.
Regent Park Fashion Show highlights local talent and sustainability. The Regent Park Fashion Show took place on Tuesday, August 27, 2024, showcasing the creativity and commitment of local residents. This year's event, held at the living room at Daniel Spectrum, embraced the themes of sustainability and culture, with the runway featuring one-of-a-kind made pieces crafted by local artisans and community members.
Sunday in the Park Appreciation Dinner celebrates community spirit. Recently, the Regent Park community gathered at Daniel Spectrum for an appreciation dinner to honor the volunteers, planning committee members, and sponsors of the Sunday in the Park Festival. The festival, held on August 25, 2024, brought the community together with music, laughter, and a delightful array of food, marking the successful return of this cherished summer tradition. The appreciation dinner celebrated the hard work behind the festival, featuring acknowledgements, feedback presentations, and a meal provided by local entrepreneurs. RPTV congratulates everyone involved in making both the festival and the dinner a vibrant display of community spirit.
MPP Kristyn Wong-Tam speaks out on safe injection site closures. The Ontario government's controversial plan to close 10 supervised consumption sites near schools by March 2025, including critical sites in downtown East Toronto, has sparked outrage among frontline workers. They warn it will lead to more overdose deaths in communities like Moss Park and Regent Park, where addiction remains a pressuring issue. Despite Premier Doug Ford's defense of the closures and proposed investment in new drug treatment hubs, critics argue that these hubs alone are not enough. MPP for Toronto Centre Kristyn Wong-Tam, a longtime advocate for harm reduction, shares her insights in an exclusive interview with RPTV's Gabriel Meissner. Wong-Tam discusses the impacts of these closures, the proposed heart hubs as a replacement, and the urgent challenges facing our communities. In this critical moment, MPP Wong-Tam's advocacy underscores the pressuring need for continued harm reduction efforts to protect vulnerable communities like Regent Park, where the loss of these vital services could have devastating consequences.
Nice to see you again.
Yes, nice to see you again as well.
Yeah. I want to start this off by asking you what your opinion is of the provincial government's plan of removing safe injection sites near schools by March 2025.
That's a great question, and I know that that is a top of mind issue for many of our constituents in Toronto Centre. Obviously, Doug Ford, as the Premier, has the right to issue whatever proclamation he may, but I think that any of those health policies should be done in broad public consultation. It should be done especially with evidence-based information coming from our health professionals. And I can tell you that Doug Ford received 2 independent studies on whether or not consumption and treatment services should continue to operate in Ontario, and if they should, how should they operate. And 2 of those independent studies both came back that those services needed to be scaled up with respect to service as well as hours of operation, make sure that there's more wraparound supports and adequate treatment beds moving forward, and none of those reports, those 2 independent reports that were both commissioned by Doug Ford, none of them said to close down the consumption sites. So it was a big surprise to myself and a lot of other members in our community, but more importantly, I think that the health professionals in Toronto Centre and across Ontario are not asking him to do that. They're asking him to address the treatment capacity to make sure that people have access to addiction recovery services, and no one is asking him really to shut down the site without a clear transition program to make sure that people who are substance users have adequate access to health service.
I see. So why do you think he put out that investigation then?
The Premier does a lot of things with respect to Greenbelt land giveaway to developers. He tried to strike away the constitutional bargaining rights of workers. He has, spent $1 billion to accelerate the sale of alcohol in corner stores. He's trying to take away the Ontario Science Centre. He's trying to shut down Ontario Place. And quite honestly, you can't really put a rhyme or reason to why the Premier does what he does. But I can tell you this much, is that he is doing things contrary to the advice of his professionals. He even had a panel of housing experts, which he himself convened, to try to address the housing crisis. And then he took the advice of the professionals and threw it into the garbage bin. So that's why I'm saying, he had 2 independent studies which he initiated around the consumption sites, and then he turned around and tossed all of that information and recommendations to improve the system, the healthcare system, and he threw it in the garbage again.
Jeez.
Yeah, that's a perfect response. It's like, why would anyone do that? It absolutely makes no sense. But in all seriousness, people are going to suffer. We are going to see more harm in our community. And I think it's important for us to recognize that these are individuals who are substance users, but they also are someone's son, someone's daughter, someone's beloved family members. There's a lot of stigma around drug use. I can honestly say I didn't fully understand what addictions could do to someone, especially when in the middle of an opiate crisis. But now that I've educated myself, I've spoken to healthcare professionals, I've visited consumption sites, I've spoken to addiction research counselors, I have a better understanding. So I took it upon myself to educate myself about this matter, and I can draw the conclusion that the medical experts of Ontario are asking for a continuum of health services that include harm reduction services, such as consumption sites, so you can keep people alive, you can resist the toxic drug supply, and build transition as well as treatment beds so that people have a pathway to recovery, which is ultimately what we want. We don't want people to continue to stay addicted to drugs. We want to give them a pathway out of the substance abuse. But when you have a blunt legislative announcement like that, Doug Ford is largely doing it to pander to a base. I think he's doing it to appeal to people's, lowest common denominator, because there is a lot of stigma and misunderstanding about drug use. I was also one of those individuals, but now that I've educated myself, I know that we need a continuum of services, harm reduction services, including treatment beds and addiction recovery programs.
And his government has talked about bringing in the HEART program, or the HEART hubs. I don't know if you've heard of them, the homeless and addiction recovery treatment. And there are these hubs that are supposed to replace these safe injection sites. What do you think about these?
I think that absolutely we should look at developing programs that are evidence-based to support individuals to help them get out of substance abuse. I fully support that. There are individuals who are chronically homeless, and as well as individuals who are living with mental illness and other forms of addiction. So we need to be able to help individuals so that they have a pathway of recovery, so they can get back to independent living, so they can contribute to society, probably get a job, grow a family, all those things. That is a good announcement. The problem is that his announcement of creating these heart centers is done so in a vacuum. And what we see is that rather than giving us treatment centers, which is good, why are you taking away a service without any type of broader consultation? And I come back to the real problem. And the real problem is that, you can't just shut down one service and expect people to get off drugs. I mean, we know that. If anyone who's ever been, addicted to cigarette smoking, I can tell you, I've got friends who have tried the patch, they've tried all sorts of nicotine alternative products, and it has taken them a long time. Anybody who may have had too many drinks too often will probably tell you that, it is very hard to kick the habit. And those are less addictive substances than what we are seeing today, which is fentanyl and opiates. And I think that it's important for us to recognize that many people who now have these opiate addictions started off with prescription painkillers. So then they may have been legally prescribed by their family doctor or some type of health professional to manage pain. They became hooked on those opiates, and then their prescription ran out, or the doctor said no more for you, but they became addicted. So it is a complicated road for anyone who has abused substance. But I think that what we need to do is ensure that the treatment facilities are there for people who are ready to get treatment, but you cannot take away the service, the life-sustaining service that will keep them alive until they're ready for treatment. Mm-hmm. Right? Which is why Doug Ford's policy is going to fail, because 20 and 25 years ago, we saw American presidents stand up one after another, declare the war on drugs. That has not worked. There has not been ever a successful campaign to eradicate all drugs around the world. So we need to recognize some substance abuse and substance use will be amongst us, but how do we ensure that we maybe have people not start the consumption, but when they do, consume it as safely as possible, but also give them harm reduction services and to give them a pathway off the addiction. And I see this as a significant problem because Doug Ford is not listening to his own experts and his own health professionals. In our patch of the city, in Regent Park Community Health Center, we have a consumption site right in that health center. It's embedded in a very respected health center, and they have nurses and wraparound support, social workers, housing workers, all of that to keep people in our community, our neighbors, healthy, to try to help them off of the substance. And that service is shutting down right in our community. Our neighbors are going to be harmed. We are going to see them consuming drugs in an unsafe manner. And I think that when they do overdose, because there's a very good chance that anybody's using substance, is going to run into the poison drug supply, and that is going to kill them if we don't have consumption and treatment centers. And that's what Doug Ford is proposing right now.
Mm-hmm. And I can also imagine that it's probably very expensive to dismantle this system or these safe injection sites too. And as much, it's probably also very expensive. I heard it was something like $370 million that they're investing into these 371 heart hubs that they're going to start implementing.
Yeah, 372 treatment beds,
Mm-hmm.
and I think it's 19 heart hubs. But so there is a cost to health care delivery. There always will be. We can't expect professionals to deliver health services for nothing. But it's going to be much more expensive for us in the long run. While people are not contributing to society, he's not addressing the chronic homelessness that often comes with substance use and abuse. He has not done the preventative measures, which includes mental health services for people upstream. So before it gets so bad that they lose their job, lose their family, find themselves without housing, and that becomes more expensive. It becomes more expensive when someone is in the emergency room all the time. It's more expensive when they've lost their job. It's more expensive to rehouse someone who has been chronically underhoused for, in some cases for years now. So Doug Ford is not listening to the health experts, and I can't stress that enough. It was only a few months ago that Ontario's Minister of Health wrote an email congratulating Regent Park Community Health Centre for their exceptional work. It was not that long ago when she was saying, you're doing a great job, and including the consumption site. It was only, it's been in for 2 years, the Ministry of Health has been asking the Regent Park Community Health Centre to actually expand their service on site. So Doug Ford has, overnight flipped the mental health addictions strategy of Ontario on its head, and no one has been saying that this is a good idea. No one who is actually working in the health sector is saying that you should be shutting down all these services in one fell swoop. And by the way, 372 beds in Ontario is enough. We can put Toronto Centre residents in 372 beds right now for addiction recovery and still have a wait list. Like, that is the reality. 372 beds across Ontario is simply not enough. It may be a nice number for him to announce, but anyone who's looking at the wait list will know that it takes you anywhere from 3 months to a year to get an addiction recovery bed. It takes you even longer if you're in northern communities, fly-in communities, Indigenous communities. They are not opening up 400 units of hearts across Ontario, which is how many municipalities we have. He's opening 19 across the province, and 372 beds. It's not going to work.
Yeah.
Yeah.
So the ideal solution would be having both.
Yes.
If you had these which I imagine we already have in some shape or form.
Yes.
Having some kind of.
Yeah.
So he's announcing this as a new thing that's going to replace the safe injection sites.
And no health professional has ever said it should be either or. And so the problem here with Doug Ford is that he's not basing it on any evidence, because everybody has been complaining. Everyone who works in the sector, in the health sector, has been complaining for years. And Ford and his government has been in power for 6 years. Everyone has noted that we do not have a sufficient, well-resourced mental health and addictions system in Ontario. It's fragmented, and it's oftentimes emergency-based. So people have been advocating, doctors, whether it's CAMH, mental health workers, or psychiatrists and other researchers, including from the Canadian Mental Health Association. Everyone has been saying we don't have enough of those treatment facilities. We don't have enough programs to prevent mental illness and to ensure mental wellness. And so we have seen a system that's fragmented, underfunded, and oftentimes emergency responses as opposed to proactive planning and proactive execution. And Doug Ford has now come along and said, you know what, I'm going to tinker with this program that's already broken, system that's already broken, and I'm going to remove one service and give you a few more of these beds. That's simply not the system that people have been asking for.
Is there a safe injection site in Moss Park?
There is a Moss Park, yes, consumption and treatment center. That's correct.
Mm-hmm. Is that one being removed?
They are facing development pressures, so the building that they are renting has been sold to a developer, and the developer has applied for rezoning. The rezoning has been approved by the city, and I understand that they've been asked to leave and close by November.
Wow, what is it being rezoned into?
It's going to be condominiums.
So that's not even part of Ford's plan. That has nothing.
That's just development pressures.
Wow.
Yeah.
So that is probably going to negatively impact the Moss Park community, which already has a higher number of drug addicts.
Yes. So we are seeing, I think, an incredible amount of nervousness and fear in the health professionals, amongst health professionals, because we're going to see more people end up in the ERs. We're going to see paramedic services jammed up because they're going to be responding to overdose calls, right? It's already hard being a paramedic. We already know it's hard to get a hospital bed. We are going to see more needles, more social disorder, because now people cannot go into a facility where they're going to be supervised while they're consuming. And it's important to recognize that people are not going to stop consuming substance just because Doug Ford said, I'm shutting down the service. They are still going to be consuming. They're still going to be consuming, but it's now going to be unsupervised, which will lead to more overdoses.
Wow, that's not good.
No, it's actually quite scary. You know, I think, and I'm not one to be an alarmist, and I have to admit, like, you know, like a lot of Ontarians, you know, I didn't know a lot about substance abuse because, you know, I don't drink alcohol, I don't smoke, I kind of live what I believe is a healthy lifestyle. So there's a lot of misunderstanding around substance use as well as addiction, but I do know that, you know, someone like myself has to follow the advice of health professionals. And there's a lot of stigma around drug use, less stigma around tobacco smoking, you know, some stigma around alcohol abuse. But when it comes to what we know as a society about, you know, substance abuse and substance use, you know, we have to follow the advice of health professionals. I'm not a doctor. I have to follow the advice of my doctor. Doug Ford is not a doctor. He should follow the advice of the Chief Medical Officer of Ontario, who has not come out and said that he should be doing this.
Communities in the downtown east gathered for International Overdose Awareness Day. The events highlighted the critical role these sites play in saving lives and preventing overdoses, particularly in neighborhoods hit hardest by the drug toxicity crisis. RPTV's Gabriel Meissner attended 3 commemorations where harm reduction advocates and community members came together to honor lives lost and demand action. On Saturday, August 31st, the 519, Street Health, and other partner organizations hosted a powerful Together We Can End Overdose event, emphasizing the crucial role of harm reduction in saving lives and the importance of naloxone training for community members, ensuring that everyone can respond to overdoses effectively.
We see so much every day. We have so much with our community, and we need to fight back at this point.
Hi, my name is Lynn Sally. I'm the Executive Director at Street Health Community Nursing Foundation, located at Sherbourne and Dundas. Today is International Overdose Awareness Day. It happens every year on August 31st. It's a day to remember and memorialize those we've lost, and also to discuss the very important topic of overdose prevention, and preventing overdose deaths, unfortunate as they are. It's very preventable, and so today we give meaning to that, and we celebrate the change that's been taking place, but also a very somber event to remember those we've lost. I've been working in the mental health and addiction sector for 30 years now. We've seen lots of change, and lots of changes most lately. More and more people are dying of this totally preventable deaths. In Canada, 42,000 people have lost their lives due to overdoses. That's comparable to as many lives have been lost during World War II. So it is a very serious health matter, and it needs much more attention than it's getting. So that's really what was important to me today, just being able to, speak and talk and discuss and come together as a community. That's more than anything is really important, because we've all lost friends and family and loved ones, and so that ability to connect was just really so important to me. Definitely a takeaway from today.
At the Moss Park CTS under the South Riverdale Community Health Center, attendees gathered at 134 Sherbourne Street to mark the day with similar activities, emphasizing the importance of safe spaces for drug users amidst the threat of site closures.
My name is Steph Pinch. I'm a researcher at South Riverdale Community Health Center, and I work with the Moss Park Consumption and Treatment Service.
What can you tell me about the Moss Park CTS and its removal and
So we're a healthcare service. We provide first overdose response for folks. So folks come in with a pre-obtained substance, use the substance within our consumption site, and we have trained professionals who are able to respond to any medical emergency that comes up. So that could be overdose, that could be any other kind of medical emergency that folks are having. We connect people to care. We've reversed 517 overdoses in the last fiscal year. Every month we have about 200 unique visitors, so unique individuals coming and using our service. We distribute harm reduction supplies. So we distribute sterile harm reduction supplies, which can look like needles or pipes or anything like that. And by providing those supplies, we reduce the transmission of Hep C and HIV, a healthcare practice that has been used for the last 30 years. We also provide a lot of holistic wraparound care for folks. So we help people with appointment reminders. We help people coordinate complex care. We do long-term chronic disease prevention and management for folks. We do case management. We help folks get housing. We support folks with employment applications, all that kind of stuff. So our return rate for harm reduction supplies is over 100%. So of what we give out, we get more than what we give out back. So we make sure that these discarded supplies after they're used are not in communities, they're not on streets or in parks or in alleys. By giving people a safe place where they can use their substance of choice, we also make sure that folks are not using drugs publicly and that there's somebody around to save them if they do experience an overdose.
And why is it important that we keep these and that we don't replace them with the cart or some other type of safe place for people to be that are more focused on treatment and less on just helping them and caring for them?
So we do a lot of addictions treatment on site. So we operate not as a residential treatment facility, but as a day program for a lot of folks. We're able to coordinate opioid agonist therapy treatment for folks. So a lot of our service users are on methadone, Suboxone, and have been able to access that through our nursing team. We also do detox calls for folks and try to help folks get into recovery. Last fiscal year at Moss Park, we made 55 calls to detox and we had 2 beds available. So that's less than a 4% success rate for actually getting folks into detox. So we support folks anywhere in their recovery journey and anywhere that they try to make a change, to have a healthier life, whatever that might look like for them, any positive change. But what we're seeing is that there is not capacity to meet the demand for detox and for inpatient treatment. Inpatient treatment is often a costly program. It can be $17,000 and up for a 1-month stay, and ODSP rates are around $1,000 a month if you're on ODSP. So that's really impossible for folks. We also know in the street supply right now, about 50% of the supply that was tested over the last year by the Toronto Drug Checking Service was positive for benzodiazepines. So people who are using fentanyl are actually also using benzodiazepines, giving themselves a tolerance, and that withdrawal requires medical supervision. There are only 28 medically supervised detox beds in all of Toronto for a city of 3 million people. So it's not enough. Benzo withdrawal and alcohol withdrawal are the two kinds of withdrawal that can kill people. We need to have medically supervised services, and this place is able to connect people to primary care, is able to provide that on-the-spot support for folks. Our model is tested, tried and true. We've been operating out of this location since 2018, and we have the evidence behind us that shows that people are being connected to care, that shows people are better off for being connected to the service than when they arrived. So we are unsure about other models that haven't been tested, and there is no research behind that. But we know this model is working for folks.
Cool. And what is happening to this CTS?
So this consumption and treatment service is losing their location. Unfortunately, the building has, our lease is not continuing. It's going to be sold to condo development. So our landlords have been very generous and kind in extending our lease, but we know that that's not going to last forever. The new announcement by the government says that no new sites are going to be approved to be opened. So if we move because we no longer have this building, then our site will close.
And do you think that condo will be good in this neighborhood?
I think there will be a lot more deaths in this area. There will...
Sorry, say that one more time.
So if this site closes, there will be a lot more deaths in this area. We don't have to wonder what that would look like. During the pandemic, a lot of services shut down, and we had staff coming to work, finding dead bodies, responding to people in the street. We do outdoor overdoses response here as well as the inside overdose response. So that's a lot. It's a lot of public drug use that we're preventing by being open right now, and also the new government announcement indicated that we would no longer be able to distribute sterile drug use supplies, and that would mean rates of HIV and Hep C would go up.
Is there anything else you'd like to add?
Yeah, these services save lives, and I think if folks want to make sure that their communities are safe places, we are very invested in the safety of this community and making sure that we give people a safe place to go where they can connect to care and where they can connect to services and where they can be treated with dignity, humanity, and kindness.
I feel like this is a big point because a lot of people are afraid that having safe injection sites are going to bring homeless people, people struggling with addiction to their neighborhood, when actually it's the opposite. You guys are the people who are actually taking care of these people and making the neighborhood safer.
Yeah, there has never been a drug-free society in the history of the world. People have and will always use drugs. We value the lives of people who use drugs. A lot of people I care about are people who use drugs, and if people are going to use, we want to make sure that they use in an environment where they can access sterile drug use supplies and where they can be responded to if they do have an overdose so it's not fatal. We don't have any 24-hour overdose response sites in this city. We have a lack of overdose response and harm reduction services to begin with. So this would make things a lot more difficult if this site were to close.
Lastly, the Thunder Women Healing Lodge Society hosted a hot dog lunch to bring awareness to the crisis.
My name is Lexi.
Nice to meet you, Lexi.
I'm the program manager here at Thunder Women Healing Lodge Society. We're a non-for-profit organization that supports Indigenous women coming out of incarceration and helping them reintegrate back into society in a holistic way, in a culturally appropriate way.
And what is this event that we're at today?
This is our Hot Dog Day event in honor of Overdose Awareness Day, honoring those who have lost their lives to overdose.
My name is Alicia Eckley, and my spirit name is Morningstar Woman.
Say that one more time?
Morningstar Woman is my spirit name.
Oh, very nice.
Yeah.
And tell me, what is this event?
Well, this event is for representing and celebrating basically for people that have passed on overdose. It's an overdose awareness day. So we sit there and we hand out Narcan kits, free hot dogs for people that are hungry. And it's a good general area for that, so yeah.
And what do you think is the importance of an event like this to the community?
To the community? Well, everybody should be aware, right? Everybody should have a Narcan kit because you walk down the street and people are using all the time, and it can happen any time. And they're actually very convenient, the Narcan kits, because they bring back from an overdose. They bring back people like instantly. So it just shows the community that people care. You know. Yeah.
It's a really beautiful thing. Just
Yeah, it is.
like everybody out here coming out, getting people on hot dog or giving people hot dogs.
It is.
Yeah.
Hot dogs and kits and information too, right? Everybody has some information here and about rehabs and treatment centers.
These events not only honor those we've lost, but also reaffirm the Regent Park community's collective commitment to harm reduction, ensuring that our neighborhood remains a place of support and solidarity in the face of growing challenges.
Low-income communities fight back against developers in Toronto. On Thursday, September 5th, residents and advocates gathered for an impactful event titled Low-Income Neighborhoods Fighting Back. Organized by downtown Toronto community groups, the meeting addressed the urgent issues of gentrification and housing justice affecting Toronto's low-income neighborhoods. Speakers from 230 Fight Back, No Demo Evictions, and the Toronto Underhoused and Homeless Union, among others, shared their experiences and challenges. They highlighted their ongoing efforts to combat policies that favor large developers over the needs of vulnerable communities, stressing the importance of stronger protections and social housing solutions in the downtown east.
We are creating a space where people do not feel so alone. When we are alone in our struggles, we believe the world when it says, "This is your fault." When we are together, we are making new friends, less isolated, and being reminded that we are not alone. We are teaching ourselves how to organize. We are low barrier, and most who are sitting at our table have not been involved in advocacy before. We are often reminding each other that bridging the division made within homelessness and underhoused class are making us stronger. A society that thrives when the poor have no power will segregate and convince us that each other is the enemy. Refugees, drug dealers, housed, disabled, shelter users, and seniors. When in fact, we are coming together across these lines, building bridges with each other. We will not be dubbed into thinking each other is the enemy. When the system is rigged against all of us. We are in this together, and the union symbolizes that in all we do, we are working to actively build bonds and create strong unity within our community. This, in turn, increases our collective powers.
The reason that fight is important is because, as people who live here or have been around here know, it's one of the oldest working class neighborhoods, and we've seen over the last 3 or 4 decades this transformation, including what's happening in Regent Park, by the way, this transformation across the downtown east, that is literally displacing people from the neighborhood. Historically, people have always come to this neighborhood where they were homeless, looking for work, and they were received. Also, if you walk around the neighborhood, as you know, you'll find all kinds of services, still not enough. And whether it's a community health center, safe drugs, consumption site, whether it's a drop-in or soup kitchen, there's a lot going around. But all of that is threatened right now, greatly threatened. If you walk along the Dundas East Corridor from Sherbourne to Church Street, there are developers like I think what they call it. They're called Kingset, Menkes, Metropia, Starlight, Pembroke. Yeah. So you'll see these names around. So we estimate that about $4 to $5 billion has been invested along that stretch by the developers. We're talking about 11 condo developments. It's outrageous in terms of what we're seeing there. And for us, Dundas and Sherbourne is the last corner that these developers have failed to develop yet. They're buying up the land, but they haven't developed yet. So we're saying this is a line in the sand. Because part of our struggle is not just this local struggle against Kingset, but really is to look at this idea of what these developers are doing to our communities. That's the larger picture, because that picture is not just at Dundas and Sherbourne, but it's across Canada. It's in Parkdale, you know, it's in Jane and Fitch, it's everywhere. And this fight, although it's a local fight at 214, 230, it's actually a national fight. And a lot of those developers and a lot of these people who fund these people who buy up these buildings that then people are evicted from, whether it's 25 St. Mary's, where 700 people are getting evicted. And the building is perfectly okay. 135 Isabella, where Ira is from. All of that is happening. So we're going to go there on September 10th at 12 o'clock. Some of the same people who are speaking today will be speaking again at that meeting. And we want to have a nice, loud demonstration to tell these people to keep their hands off our neighborhoods.
Now for events in Regent Park community. Local councillor Chris Moyse is hosting Toronto Centre Ward 13's next series of neighbourhood town halls. Regent Park Neighbourhood Town Hall will take place on September the 24th from 6 to 9 p.m. at the Regent Park Community Centre, 402 Shooter Street. Hope to see you there. Free Activating Community Leadership course starts October the 8th. The Center of Learning and Development invites Regent Park, Moss Park, and St. Jamestown residents to a free Activating Community Leadership course starting on October the 8th, 2024. Held every Tuesday from 6 to 8 p.m. at the CLND at 540 Dundas Street East. The course features weekly guest speakers from Urban Studies at UFT. Dinner is served at 5:30 p.m. and childminding is available. Register by October the 1st. The Children's Book Bank in Regent Park offers free books for children. All children and families are welcome. The Toronto Community Housing, Our Spaces, Our Ideas. Tenants can book a TCHC common space for community events or programs. Types of bookings can include private events, one-time bookings, or recurring events. For more information, please contact Felicia White at 416-356-7603. And that's all for today's show, folks. I'm Kedar, and I've been joined by my co-hosts, Jabin and Gabriel. A big thanks to our dedicated team of researchers who contributed to this week's episode. And from Focus Media Arts Center, thank you for watching, and we'll see you all next week.
Don't forget to like, comment, share, and subscribe to our YouTube channel. And please follow our social media platforms. For more information, check out our website.
Weekly.